Welcome back to the Personal Health Care Reform Talk Show. I'm your host, Clint Fuquay, the health engineer, and today, dorsal flavors, we're going to be talking insurance. We're going to make an impact. We're going to make a big impact on you and your life, and a much smaller impact in your bank account.
Oh, it's a pretty good impact
actually,
there too, right?
We're going to make a really good, big impact on your bank account, and for a little impact on your bank account. So it's going to happen. So, Doris, thanks for coming on.
Thank you very much for having me and helping us spread the word that there are options out there, because you know that right now, this time of the year, is when you have what everybody calls open enrollment, where you do all that stuff. I've seen some of the numbers, especially for some of my small businesses, and yet someone that's paying $400, it's healthy, 29 years old, their insurance went up $70 for less services. Everything's higher, and it breaks my heart to see healthy young people not realize that there are options. And did you know the majority of Americans are relatively healthy?
Well, sort of.
Well, okay,
sort of.
You have to now. I know
Sort of.
when you can call having high blood pressure that's controlled, high cholesterol that's controlled, that's no longer considered pre-existing. Yeah.
Okay.
Sad, isn't it?
Yeah. I want to give everybody some background on you right quick.
Okay.
Before we start getting into the insurance thing. This way, everybody knows it's not your first time in with insurance. So, because you were doing insurance policies before the ACA.
Yes. And
ever since the ACA, and now hopefully with the wind down of the ACA, the ACA, by the way, if you don't know, is Obamacare. I don't like to say that name, because I'm not going to give him any credit for that, because it wasn't his. He just sold it. So the Affordable Care Act
that is not affordable.
Is not affordable, and the level of care has decreased every year since they started. So
yes, unfortunately, a lot of the doctors are pulling out.
Oh yeah,
because they can't make any money, and there's just so much waste in the system now that can they unravel it immediately? No, there's no way. But so many people don't realize there are options out there. Of course, you have your employer coverage, which if you're going to get health coverage like that, that is the Cadillac. If you've got a good employer plan, you're still going to see your rates go up, but not quite as much. Yeah, because the marketplace it's going up a lot.
Yeah, it's depending on the employer and what kind of deals they've made. Although most of them are self-insured, so they kind of they pick their own deals.
Yeah, it's very nice because.
But that bronze policy.
You might as well just sit down and cry, because that's about all it's good for.
Yeah.
It's and then with them, they're going to be taking away. And when people say they're taking away subsidies, that's really a little bit of a not quite an exact comment, because the subsidies or additional subsidies have been added. And they actually had a timeline at the end of this year that they would expire.
Yeah, December 31st is the sunset. And this is a little inside baseball for everybody out there for this whole government shutdown thing. There's a push to get that deadline extended, and if they don't get it done now, it's not going to happen, because everybody wants that thing gone. So that's one reason why the whole government shutdown is going on, because there's a lot of money being put into DC to make sure that extension happens, and so they're going to keep things shut down until it happens, or until people revolt and say, "Hey, open up. We need stuff done," which is going to happen pretty quick. Actually, it's probably going to happen by the time y'all see this show.
Well, and one of the things that I read, and it was kind of because I try to keep up with what's going on in the system and everything, and the big boys, the big insurance companies, they really started raking it in. When the marketplace opened up. First they pulled out, and then they realized, oh wait, a lot of money can be made here. And they also make money, which this upsets me, because this should have never been allowed to happen. They also control the supply chain for the pharmaceutical. They are also the middleman. So when you have to go pay $300 for a drug, that everywhere else in the world you can get for 30, it's because the middleman decides what they're going to sell it for,
Yep.
not the pharmaceutical houses. So everybody immediately blames the pharmaceutical houses. It's actually the middleman,
Yeah.
which United, Blue Cross Blue Shield, Cigna, Aetna, they also are their own middlemen.
I was going to say, yeah, they are, they've created their own boogeyman that everybody gets mad at, which is actually them
Mm-hmm.
through a separate company. Okay.
Yes, but like I said, it was allowed to happen, which is really too bad because, and I know you are too, I'm a firm believer in the market will balance itself if the government stays out of
Yeah.
it.
Yeah.
That's
If there's a market to, if there's a market, it will balance itself. If there's not a market, it can't balance itself because it's being balanced by somebody else with the thumb on
mhm.
the scale, which is what's been happening for the past well, since 2007,
Yeah,
2008.
yeah. So, but wanted to let you know that there are options out there. Some really, and this is one of probably one of my favorite options. It's a health sharing. It is not what the Affordable Care Act, the ACA, they don't consider it credible coverage
Mhm.
because it's not theirs.
Exactly.
They don't control it.
Give everybody a little background on the health share,
Health sharing
health sharing,
started
because
probably
yeah,
25 to 30 years
yeah,
ago, and it started in the churches, and everybody started sharing the bills and the medical bills and things like that, and then it started expanding out because it was working. Uh, Majority of the health sharing, they're nonprofits. So their money does not go to the CEO, the president. They have to be very, very careful because they're not allowed to make a profit. And so they're, that's one of the reasons that they're able to offer better rates
yeah,
also. And there are several very good um, health sharing systems out here. This is one of my, like I said, this is the one that I've done so much research on it. This is more for the consumer, for the client.
hmm,
This is more like using what we're traditionally used to, where you have a card and they pay the doctors. You don't have to pay the doctor and get reimbursed. They actually have the system because the folks, Bill Presser is the CEO president. He actually came from the health sharing, the Christian side. This is
yeah,
where you don't have to be a church affiliation. This you just they prefer you to be ethical,
yeah.
which we prefer everybody to be
Well,
ethical.
essentially, they want you to go
Yeah.
in and be healthy.
Yes.
Essentially, the big issue that usually happens with health share organizations is you have to be part of a church. You have to prove that you're part of a church. You have to prove a lot of stuff before you're allowed in. Then there's a lot of payout before you start getting coverage, stuff like that, right? This one is essentially we'll call it non-secular because you don't have to be part of a church. This is just part of it is you have a health declaration that you give
Hmm.
before you
Yes.
start, which is I'm not going to smoke. I'm going to eat well. I'm going to exercise, stuff like that, right? Because when you do that, you're not going to be a drag on the system, and as part of it, this is insurance for the what if of the big bad ugly stuff, right?
Hmm.
Um, so if you get cancer, things like that, it's to cover the big outlay costs, not the small outlay costs. Which if you don't know, when you do the I'm just going to pay cash right now is a whole lot less.
Cash pay. Oh,
cash
it's
cash pay is a whole lot. When you go see the doctor and you tell them I don't have insurance, that cash pay is a whole lot less because you're paying out essentially what Medicare, Medicaid pays out, which is
and they get it immediately.
yeah, they get it immediately. The doctor didn't have to fight for that, which they normally have to fight for that for about 90 to 120 days,
Hmm.
and they maybe might get that cash pay amount out of the insurance company.
Yeah, because they fight them on it.
Oh yeah, oh
Yeah, they'll
man,
fight a doctor on it. It's just, and like with Impact, there is no network. All they have to they need to be a licensed facility, of course,
yeah,
but you can go to any doctor that you want as long as like I said, they've got a license. One of the things that they've also, what Impact does, one of the reasons that I the they do make money, but it can't be profit. So they keep increasing their services.
Yeah.
They have I remember I mentioned to you earlier, a
Yeah.
wellness plan to where um, it's 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 your deductible. It's called something separate because it can't be called deductible because it's not ACA compliant, but it's basically what we're all used to is the deductible, and it counts every month for gym membership, for your supplies, your supplements, even acupuncture
Yep.
and naturopathic. They they credit you back your deductible back $150 per household. And another thing with their deductible, it's per household. It's not per person. It's maybe 2,500, 5,000, 7,500 per household. Unlike
Yeah. And
starts at 90 on like the marketplace, you'll start at $9,200 and it can go up to almost 20,000 for the
oh
household.
yeah, yeah. A household of 4 or 5, you got $25,000 outlay before
Hmm.
there's even a penny that goes into from the insurance.
And I'm sorry, I don't have just 25,000 to throw out there.
Yeah.
You know,
Yeah. That's a car. Well, that's a used car. It's not even a new car now. It's a used car. It's a pretty nice used car.
yeah. But like with Impact, it also has drug. It does have drug pricing in there, and they are the middleman. They go straight to the pharmacies, so or the pharmaceuticals. So you don't. The price is like 50 to 60 to 70% less,
Yep.
and they let you compare your different um, pharmacies, like CVS versus Walgreens. CVS may be higher, Walgreens may be lower, or vice versa, or your family. It's a system made for people to use
Yeah. Yeah.
and to make it easy for
Yeah.
people to
Yeah.
use
So
it.
you're essentially getting favored nations prices, which are starting to get rolled in now. Which
Mm-hmm.
thank you, Trump, for
Yes,
pushing
Trump
that forward,
RX.
and HHS, RFK Jr. pushing for that. So now the favored nations pricing, the U.S. starts getting a lot of that. So you're going to start seeing pricing for pharmaceuticals come way down,
Yeah.
because the middleman can't stick to everybody like they've been doing. It's going to take a little bit of time to unravel.
But it's
Yeah,
starting.
yeah, it's starting.
It's starting.
It started with insulin pricing,
Mm-hmm.
which happened under Trump's first term. They got that pricing regulation taken way down for insulin. But yeah, everything else is going to start coming down pretty rapidly over the next year. One thing about Doge for everybody out there, part of the Doge program, since they're going in the back end, looking at how everything's tied together, the ACA, a little inside story on this, it is attached to every part of the government. Okay, it's got little arms that are attached to
Mm-hmm.
everything. So to change that system, get rid of it, eradicate it, and turn it into something else, you have to literally unhook all these hooks that it has into literally every part of the U.S. government. Until those are done, it's still there. So it's not it's not 6 months, it's not 1 year. It's like a two,
No,
3 year
it's a
process. Yeah,
process.
it's a
Yeah,
big long process of doing that. But once you start unhooking those, which Doge has
started.
been systematically doing that really quickly, by the way. It's going to help out with what's about to happen next year with HHS under Kennedy, and there's about to be a lot of big major reforms happen, new legislation for healthcare. So get ready for that in the next 2 years.
Yes.
It's going to be a major
And
sweeping change.
the wonderful thing about it is it's about us.
Yeah,
It's giving us choices again and helping. It's we're not feeding the big boys. You're actually able to afford and have
yeah,
good health care. That's what
yeah.
they're pushing for.
Well, the thing is, you'll get to, you're actually going to get to own your health. We'll start off with the health records, okay? Right now, you don't own your health records. The medical establishment owns your health records, okay? They hold them hostage from you. Now, I think starting this next month, you get to have your own health records and carry them around. You own them again for once. So this way, you can choose your doctor. You can go to different places, especially if you have something like this. You get to own your health and go where you want to go. And eventually, you'll get back to where you can just go see a specialist for something. You don't have to go see your primary care and hope you can get in. And then you get sent off to somebody else and somebody else. And then you get to see this specialist over here. And they say, well, I need you to go back and see your PCP for this. And you have to go back. And it just circles around uh, for quite a while. I know people have been through that. runaround system, and it's almost like what they have in Canada, but not quite as bad yet.
One of the things you were about the this healthcare system, and it is very costly,
Oh yeah,
is Impact has a whole team that negotiates. That's all they do is negotiate, because a lot of people don't realize that hospitals, or majority of them, are tied to church affiliations. Not as much as they used to be, but they're still nonprofits. So they get funding from the city, they get funding from the county, they get funding from the state and from the federal government. So your hospital bills shouldn't be as large as it is. And these guys come in and they just start slashing because they know what to say. They know how the system works.
yeah,
And so you've got these guys fighting for you in your back pocket.
they know the coding.
Mhm.
The coding whenever you go into the hospital, they've got codes for everything, right? Uh, ICD-10 is the brand new coding language that they have. They used to be ICD-9. Everybody knew how to game the system with that, and they put in ICD-10, which is tougher to game. But if you know what's in there, these guys have a whole team for that. Is figuring out what billing codes should be used for different things, right? And a lot of hospitals use billing codes to where they can take this price and get it up here because they know what codes used to get that up. These guys know how to take that price down because they know the codes, they know the coding game, and that's why if you look at the cost from a hospital standpoint, medical standpoint, you have this much cost for the actual medical procedures. You get this much cost on top for all the administrative fees that are going on with the full administration within that hospital, which is a lot.
Which is when they talk about healthcare getting more, has increased in the last 3 to 4 years a lot, like the
Yeah,
biggest jump in years. And it's not for the surgeries and stuff, it's for the administration,
yeah,
it's for running that hospital. And it's like, well, how come you could run it before? It's just, it's not just, it's not the doctors, it's the hospital
yeah.
that's driving that up. And that's what they're looking at also, is why. And since COVID, that's when it started happening. I mean, that nasty word that we all had to live
Yeah,
through.
COVID pushed forward a lot of changes
Hmm.
people weren't expecting to happen. I knew they were coming, but and it was a major push for some huge changes going on within medical establishment structure, stuff like that, so they could take and start increasing billing and increasing how much control they had over the population for doing certain things. Because once they get you to do that, just to keep your job or to go buy something or to go out to eat, man, they started getting some major control for a lot of stuff with that.
Yeah,
Um,
and people, I think because of the way they handled it,
yeah,
I think they did use the scare tactic.
yeah, they use last year. Well,
And
they tried robbery, which is, hey, we if you go do this, you're going to get a donut and a hamburger. Well, that didn't work. Okay, we're going to give you some money. That didn't work. Okay, if you don't do it, you're going to lose your job. And there's a lot of people that lost their jobs over
mhm.
that. I almost lost it in gym over that, right? Because I'm in this world. So the gym that I was working out of almost was, we were a week away from shutting down, giving up the keys, and that would
Mhm.
have been it. That gym would have been gone, dead and gone forever.
Yeah, there's
Um,
businesses that
yeah,
weren't able to come
yeah,
back from it, unfortunately.
but
But that's when the healthcare costs
yeah,
started creeping up at the facility side more than
yeah,
anything.
yeah. Let's talk about enrollment right quick, since open enrollment season is here, right? What do people need to look at? Because not everybody can meet with you. So whenever they sit down and they're looking at their options for open
Hmm.
enrollment, or sitting down with the person that's doing all the enrollment stuff for them, what are some questions they need to ask? What do they need to look for? In
The first thing is you need to really think about where you're, and of course, putting aside, accidents and things. But if you're relatively healthy, what are your needs? Do are you type 1 diabetic? I hope not, because you're kind of stuck. You got one option. Well, two: corporate employer coverage or the marketplace. So what you need to do first is, do you have pre-existing conditions? And make sure whoever you're speaking with, that they verify and validate if that's considered a pre-existing or not. Because if, like with impact for 3 years, if let's say you had cancer 3 years ago, they cut it out, gone, right? No chemo, no nothing, no medication. You're free and clear for 3 years. That is no longer a pre-existing condition. A lot of places are 5 years, they're 3 years. Uh, so really go over, uh, do a health assessment on yourself. Find out what medications you have, because they, the way it's set up is an insurance company covers generics, preferred generics. When you start getting into your name brand uh, prescriptions, they only have to accept one or two. The rest of them, they can say, no, we don't cover it. There is ways around that, which one way it is contact the pharmaceutical company. They'll help you out a lot.
Yeah, because they have to give you help.
Mm-hmm.
They have to give you help.
Uh-huh. And so but probably those are the two biggest things. What are your currently, how healthy is the family? What are there pre-existing conditions or not? And your prescriptions. Those are probably the two biggest items. And then start looking at the cost. Please look at the cost of things. Like you said, the bronze plan, like on the marketplace / Obamacare, it your individual deductible is about $9,200.
Mm-hmm.
$9,200.
Yes, that's before anything gets covered.
Mm-hmm. And make sure you understand what is a copay and what is coinsurance. I don't know, well, yeah, they call them because it's very confusing. Your copays are what you pay at the doctor's office, right? Or the specialist. Coinsurance is the amount that you have to pay, what the percentage is, before insurance kicks in. Uh, that could be 20%, or you could be liable all the way up to that $9,200, and then you have to pay 20%. It just starts getting real. It's a numbers game. That's the easiest way to explain it. It's a numbers game. And if you don't ask, or if you don't understand something, please make sure that you do not sign anything until you get that explained to where you understand it. Because I've seen too many people get burned because the decision you make today, even though it may look like you're saving maybe $100, $200 a month, is going to bite you, because they're going to make their money back.
Oh yeah.
It's you may save it on the front end, but you're going to pay it on the back end. It's just, there aren't any, especially with the traditional, like the marketplace, and even you've got what they call indemnity plans, where you can get other insurance. It does not cover pre-existing, and a lot of times it will not cover maternity. Some of them do, but quite a few of them don't, because they're not allowed to. The government said, no, you can't cover that, to force you onto the marketplace.
Yep.
And make sure that, like I said, just ask questions. And if someone tries, and this is the part that it happened to me when that's how I got into it, because I left corporate America and had to get insurance for the family, and it was a horrible experience. And I thought, there is no way people should have to go through this. It was confusing. It was frustrating. I felt like I wasn't being told all the truth, and I was spoken to like I was stupid. And I thought, no, that's not the way this is supposed to work. Where this is about your health coverage and your family's health coverage. And I always tell people, you're not replaceable.
Yep.
Really think about it. You can insure your car, but it can be replaced. You know, I tell it to people all the time, insure everything you want, and then you have no health insurance. You cannot be replaced. You know, so please make choices and ask questions. If that is probably the biggest thing.
And ask a lot.
Yes.
If you need some help with that, I'm not going to push ChatGPT or Grok, but you might want to go in there and say, what all questions do I need to ask before I get health insurance? And it will give you all of them.
And then if you go back in and you can phrase it because sometimes they give you kind of that
Yeah.
and say, talk to me like you're a real person, and they'll break it down. But yeah, it's amazing AI what it does.
Yeah.
Amazing. But please look at your health coverage options because, like with Impact, it can save you 50% on what your family of 4, 5, 6, maybe $650 for really good coverage. And a lot of policy, I looked at a policy yesterday for someone, and for a family of 4, it's going to cost them $1,200.
Yeah. So for everybody out there, how do they get a hold of you if they're here in Dallas?
You can reach me on my message me 817-371-2223. We made it easy so I could remember my number.
There you go. So if you're out of the marketplace and you need something, make an impact. Contact her, okay, and she'll steer you in the right direction for whatever you need for wherever you're at. Right. For all the business owners out there,
It works for businesses too. It can make it. It
look,
can make
look
an
here.
impact
Yeah, yeah.
on what you're able to offer. Just remember, knowledge is powerful. Let's give you some power.
Yep. And for everybody out there, thank you for joining us. Clint Fuquay, the health engineer, the Personal Health Care Reform Talk Show. See you on the next episode. And before then, do great things for yourself every day so you can do great things for other people every day because that's why we are here. So you can make an impact.